Hello, everyone. Thank you so much for joining us today. My name is Kayla Helm. That's my sign name. I am a Black hearing woman. I am a student here. I work at the University of Michigan as well. I'm an ASL student as well. I normally use my voice, but I just wanted to make this brief introduction to American Sign Language. And after this, I will let the interpreters take over and I'll use my voice.
So thank you so much for joining. The Deaf Health Talks is a virtual monthly community health education for members of the deaf and hard of hearing community. And the Deaf Health Talk are hosted on Zoom and also on Facebook Live. Each month, we cover a variety of health topics. If you're interested in receiving any information about these talks, please feel free to look at some of the information the Deaf Health Talk team volunteers will be sharing throughout the talk, whether that's our listserv, the website. I also want to say that the Deaf Health Talks are made possible through the efforts of a lot of different people and organizations, including the University of Michigan Department of Family Medicine, the MDisability program, Michigan Deaf Health, Partners in Deaf Health, and the Michigan Medicine Interpreter Services. So thank you to everyone for making this possible. This talk is captioned. If for some reason you're having any issues seeing the captions on Facebook Live, please feel free to join us over at Zoom, where there's a better visibility of the captions. Also, this is meant to be interactive. Questions are welcome throughout. And again, please feel free to take a look at some of the links the volunteers will be sharing throughout the talk. So this month, we have a really important conversation on racism and autism and how they impact Black deaf health. I would like to introduce our two presenters. We have Mrs. Diane Bass from Deaf and Hard of Hearing Nursing Organization, as well as Leanne Valentine, family and marriage therapist and adjunct professor at the National Technology Institute of the Deaf, Rochester Institute of Technology. And I'm just going to let them take it away and introduce themselves.
Okay, well, wonderful. Hello, everyone. My name is Leanne Valentine. This is my sign name. I'm a marriage and family therapist and also a professor at NTID, National Technical Institute for the Deaf. I primarily teach anti-racism. That's what I focus on. I also work as a marriage and family therapist under the University of Rochester. I work with the Deaf Wellness Center. Currently, I've been working on actually establishing private practice, and I'm very excited to join this talk today and this panel. Thank you so much for having me.
Hello, everybody. My name is Diane Bass. This is my sign name. I just graduated from the University of Detroit Mercy and to become a nurse. And right now, I'm in the Foundations of Deaf and Hard of Hearing organization on Facebook. I'm one of the founders of the Deaf and Hard of Hearing organization on Facebook. And I work with those who are under 6 years old. And I'm also working with older individuals for health needs. I'm going to join this talk tonight, and I'm very happy to be part of this.
So Leanne, you could go ahead and start.
Sure, I'd be happy to. So we know today that we're seeing just so many different things occurring in this country right now. We're seeing just enormous numbers of just supremacists, white supremacists. They're getting a lot more airtime now. We're seeing a lot of oppressed communities. And a lot of people don't actually realize that the BIPOC community is actually experiencing marginalization. It means in some ways there are even smaller groups, deaf BIPOC, community is even a smaller subset of that. And often those people, we face even harder challenges. So that really affects our mental health in very big ways. I think that's the main topic of today, of this conversation that we'd like to broach today, is learning more and sharing more about being folks in a marginalized subcommunity.
And then my work and my research in school, I found that there's a lot of problems within the deaf Black community, a lot of gaps. And there are not enough services to meet their individual specific needs, not enough specific services, doctors who know, or people being placed in nursing home alone. And these disadvantages really impact their health. And also, we need to be very clear about the word racism. And racism is focused discrimination from a majority group. Audism is an attitude that says that if you can hear, you're better than people who can't hear, or your level of hearing, the more hearing you have is better than if you have less hearing. And so we have a Black minority that's experiencing a lot of discrimination on multiple levels when you add audism on top of racism, whether it's a medical professional or that or type of, in the hospital system. They say they're not discriminating, but they don't realize that their behaviors are discriminatory in nature. And that impacts the Black deaf community. And the disparities, their lack of access to language. I think you're muted.
So really, the important thing is having activism. There are so many different communities and groups that need more activism, most especially in the minorities. So in white communities, people tend to make assumptions. They tend to generalize their experiences, and they have to understand that everyone in these communities is not the same. But they do make that mistake, that we all have the same experience as marginalized people, and that is not true. So we want to understand, not Black people do not come from one country. People make that assumption. That's a real common misnomer. Black people come from Africa, but that is not true. Africa is not one country, and in fact, people come from different islands. They come from Canada. Black people come from all over the world in different countries. And so that's one of the things that we really need to work hard to challenge, ideas like this. We are not all from the African continent, and that will help people understand us better.
I agree. And we all have some kind of ethically, because we're not all from the African continent, I agree that there's an ethical consideration there, but also how you label those minorities. Are they persons of color? Are they Black? Are they African Americans? I mean, you could be Black Latino. You could be Black Dominican Republic. You could be Black European. You could be Black, but just from America, right? There's a whole spectrum that describes the Black community. And it's just this color of skin. But culturally, there are different unique languages, and each person's intersectionality is going to be represented. For example, I'm not from Africa. My family's from the South in America. And so I can't say I can't trace my roots back to any other place beyond where I was. I was born in America. I'm an American. You know, I have some Black culture, but then I have other cultures that make up my identity as well.
That is so true. The concept of intersectionality is something as Black people, we automatically have intersectionality because we face so many different barriers and divisions in the deaf Black community already. We face so much aggression and divisiveness from different groups. It's difficult. We don't all share the same experience, like you're saying. For instance, one big issue that I'm seeing these days is colonialism. That's just such a big issue that Black people are feeling, that, people understand, you know, all people who look European are therefore European. Light-skinned people are European, and people assume that that means that's the truth. But in fact, for instance, like we're talking about now, Diane and me have very different colors of skin, and people might make different perceptions or assumptions about me because I look somehow more white, more light skinned. And those are things that are very upsetting for us in the BIPOC community. That's not a description of who we are culturally. So now we're seeing that concept of colonialism really infused in our communities, which is a problem.
And also, for example, within my family, my parents are both Black, but my oldest brothers and sister, they're light skinned, a little bit more like Indian American or Latino Mexican skin color. And then as you get, my older sister is very dark skinned. So all of us children have completely different skin tones. And that's just the way we are, right? That's the variety we have within our family. So we have to be very careful, because I know a few stories where a girl who is Mexican, but because her tone was so dark, they labeled her as Black. Had a dark skinned baby. And so they labeled her baby as Black. And so like the skin color is so important to remember, that there's a spectrum. You can't assume by a person's skin color where they're from or what their identity is.
So true. That is a very big thing in this community. And it also comes to an intellectual level in some ways that can be so upsetting. For instance, I graduated from a school for the deaf in Rochester, New York, where I am located now. And often we'll see different groups. I mean, it is what it is, but there are people with lower educational levels, is what I'm trying to say, that have maybe less education than the general population. And so we'll see these kids who have less access to education, they'll have behavioral issues, or they'll have other problems with learning. I mean, these are normal things that children sometimes have, but the majority of kids who are involved in that subset, really, mostly they were students of color, unfortunately, in that marginalized group. And to me, I didn't realize until many years later that that less educated group was actually kind of a subset, because people had already made the decision that they were not able to get that education. There was a lack of education. There was a lack of access. They weren't, the parents weren't able to be involved in the PTSA because they were working hard to make a living for their families. And so I realized that folks with less access to education were also less respected, but it kind of was co-occurring. And so they had less involvement with the teachers, even their parents, they had less encouragement from their teachers, the students, to excel academically. The parents didn't even know how to get those resources to support their deaf students. So it's a challenge for me to see those students who were labeled as behaviorally dysfunctional or challenged in other ways. They were actually more often people of color, but we have to understand how we can overcome these barriers. We get angry and we say, oh, these people have behavior problems, but we have to look at their home life first. We have to work with the parents, and it's often students of color, but we need to make sure those people are not just facing systemic barriers
And also, children of color don't have role models. Where are they looking to see Black teachers? When I was in elementary school, I didn't have a Black teacher until third grade. And it was one teacher. And then, third grade, and then not again until fifth grade. So I just one teacher, and it was one Black woman and one Black man. That's it. When I got to high school, there were finally a few teachers of color. And then when I went to college, there was not a single Black instructor. I went to a Black school. Until I went to a Black school. And then, all the other, and then even then, most of the teachers were white. There were just a few Black teachers. And so we don't have Black teachers as role models quite often. And I agree with Leanne. Children who have quote unquote behavioral issues, it could be a cultural thing that's coming out. It doesn't actually mean it's a behavioral problem, but they make the determination that they have to be in a separate program. Is it because they're Black? Or is it because they don't have a lot of, because they're not empowered as a minority? You don't know their family background. You don't know where their parents have come from. You don't know their parents' educational level. You don't know what's going on at home, but that gets ignored. But instead of focusing on that, like encouraging our children and helping them to excel, we want them, it's not just one or the other, right? We have to be able to focus on both and make improvements in both. Having a greater percentage of Black teachers, having more Black deaf teachers, and also white deaf teachers. It's not one or the other, but both.
Oh, I agree with you, Diane. It's so much about who is in the field. When I first started studying to become a therapist, I had to look very hard till I found other Black, deaf marriage and family therapists. They're just anywhere. So I'd reach out to them across the country, and I'd contact different agencies to see if they knew of any Black deaf students in the field. And mostly what I heard was, no, you're the only one. And it was shocking to me because, I couldn't believe that. It was almost a burden to build the pathway, to pave the way for future BIPOC deaf people to become marriage and family therapists or even get in the field of psychology. So it's still very challenging. It's a lot of time Black students come to me and they say, I don't know if I can get into a certain field because my English is not good. And I say, no, of course you can. You have these predetermined barriers that perhaps you can't do it because you've been told that you can't do it. And that's so unfortunate.
Absolutely. When I was my first year of college, I was wondering how I was going to get into the health field. And I had people looking at me and their response was, you can't do that. And for me, I wanted to push back against that. I worked really hard to, in fact, prove that a deaf person could become a nurse or a doctor or whichever profession they chose within the health career. And so I had to really take a deep look at myself and like, wow, there was no percentage of how many BIPOC deaf professionals there were. You could see a percentage of deaf professionals, but there wasn't a percentage, there wasn't a statistic out there of how many signing professionals in the health field there were. I mean, there were general statistics, hearing loss, but you couldn't drill down into those numbers. There was no evidence to support the work that I was trying to do. And so we really need to build this up more. We need to have the statistics to be able to prove this. Statistics of people who finish their degrees, who get a degree in the health field, to know what their signing level is, have information about their background. We don't have the statistics we need to be able to drill down and say, these are where our professionals are coming from. Maybe we have that, but there are systemic changes that are going on that impact BIPOC children. And we need to figure out a way to help them succeed, but the systemic changes are keeping them down.
I agree. There's a lot of condescension. There's a lot of oppression we need to fight. And there's a lot of audism involved as well, because often, systemically, people will really think of your hearing status first, not your race. But often it's the other way around. We feel, that sometimes race is primarily the barrier, and then it's the audism. So actually it's probably a tie, and so it's a challenge systemically, and the systems are catching up very slowly, and we're working hard, and they're changing slowly, but we're continuing to work on it. If we have a better system, we have better access, we have better equality without the blowback, because that's, when we fight to prove equality, we often get some pushback, and that can even oppress us even more.
And also, I've noticed, like in a job interview or trying to get into school, if your signing skills are on par, but your English is subpar, you're going to be deemed unsuccessful, or they're not going to think you'll be successful because of your English skill. But you need to be able to have access in both languages to be successful. My English is not great, but I'm competent. So when I would have the English teacher during school come up to me, they would say, you speak very clearly, but your writing skills aren't there yet. I mean, they're looking at gaps in my education as opposed to supporting me to come up to the level that you need me to be at. So I noticed during one interview that I had for a job, the interviewer was a Black woman who was a nurse manager. And she knew that I had the ability to speak, knew that I had hearing loss. But I said, if you look so uncomfortable, why are you interested in hiring me? And she says, well, you're right, I am uncomfortable. I don't know how we're going to communicate when you're on the job. So if I look at them first as a Black person, and if I was white, how would you handle that? And that kind of threw her. Is it you don't want me because of my hearing loss? Without any support. If you have other deaf patients, because I worked, in environments before where I communicate with patients who are deaf, and so sometimes you feel like the deafness isn't valued, but that could be a real asset to the job. That's a key to changing the system. You don't want to remove those people from the opportunities that they can have. They can push for culture changes. They can push for access. Don't push those individuals to the side. Give them an equal chance. For example, white doctors, white teachers, right? You have the students who you can see that there's this, they fit, but they give access to the white children and white doctors. So well, where's that same opportunity, that same access for the minority communities? Access in your language that matches your culture, that gives you equal footing.
Yes, I mean, I remember entering Gallaudet in 1994. It was almost 30 years ago, and I remember stepping on the campus of Gallaudet University and not knowing how to communicate, because all my life I had been raised orally and with signed exact English, taught how to lip read until I was 19 was when I was first exposed to this community of sign language. And so I remember, sitting around a table with all these students communicating with their hands in sign language. And I went back to my dorm room and I just cried. I called my mom and I just said, Mom, I don't think I can do this. I'm not going to be able to make it here. And my mom reminded me to stay calm and she reassured me. But for me, that was a culture shock. That was my first awakening to sign language. And it made such a big impact on me as a Black deaf student, as a Black deaf woman. And still, it makes a huge impact on who I am today as a therapist, as a professor. Sometimes, we have to adjust. I have to adjust how I teach to match my students so that they understand how I'm signing. And with Black students in my classroom, I once had a student come say to me, you sign great, but I notice you spell a lot sometimes. And I said, well, sometimes I catch myself spelling because I want to make sure everyone in the classroom understands exactly what I'm explicitly saying. I was brought up speaking. I don't want to go back to signed exact English, but sometimes I have these habits. And the deaf person says, hey, you're deaf, you're fluent in American Sign Language. Maybe you're not supposed to spell. And that was interesting. It was an interesting conversation that they reprimanded me for using a lot of finger spelling of English. So, we've got Black folks, deaf folks, regardless of their background, we're very marginalized. And so that was actually, a conversation that showed these different areas in which there's marginalization, whether we get into nursing or we get into being primary care providers. Sometimes we get with some luck, like I remember there was one deaf woman who's also Black, and she was studying to be a doctor. And I think she was just she was very humble. She wasn't very outgoing, she was very quiet, and I was surprised when I met her. I said, hey, you're becoming a medical doctor, like, hello, you should be so proud of yourself and so outspoken. But she was so humble about it, and that struck me. That really struck me.
And I remember there's a question I saw posted, being successful in college with your level of English. And I feel very lucky because I had 3 professors in college for English, and they were all very supportive of me. They helped. And then my high school, my science teacher was so helpful in me, critiquing my writing, helping me work hard to bring my level back up. I would submit a paper, she would edit it, I would revise it, she would edit it again. She was white, but her grandma and her mom were also teachers. And so she just had that instinct. She really wanted to help me. And I would be able to sit with her and really dig into what her edits were and think, why is this wrong? And she would take the time to explain it to me. So go to a tutor, sit down with somebody who's very proficient in English and have them work with you. Stay motivated, read as much as you can. That's really going to help you get better in English. It's difficult, but you can get better.
Oh, yes. I want to add to what Diana's saying. I work with families, of course, in my work, and often parents will ask me in session, how do we make sure that my child is successful in their English skills? Because they want them to read books. I encourage them. Children love books. Take them to the library. Picture books, start with picture books, and from there increase their vocabulary, but teach them to read, teach them to love words. That is such a beautiful thing. You can't tell them, oh, you're not reading well, you can't read picture books, those are for little kids who are struggling. No, you have to start where they are and encourage them with love and positivity. And if you can imbue them with that love of books, they will be involved in language for the rest of their life, and their English skills will develop in a rate you can't even slow down. So, in that concept, if kids are interested, I get kids sometimes reading until 2 o'clock in the morning once you spark that fire and that passion, even in elementary school. Sure, elementary kids want to play outside, but when I was a kid in elementary school, I always had a book with me. I played, but I always had a book with me because that love of reading was really fostered. So I tell parents to do that for their children. I encourage them to just give that love of books to their little ones.
Another thing I'd like to emphasize, as a BIPOC patient who's going to a doctor's office, when you're in that setting, if the provider is white and they don't know their language, they don't understand their hearing level, they don't understand their culture, and yet they're there to get treatment. It's very difficult for those patients to navigate that environment. And you have a provider who's not able to understand their patient, and often they give the wrong diagnosis, and that leads to improper treatment. So it's a very negative impact on that person's future health, and they have higher risk of health problems, diabetes, cancer, because they don't have access. Their needs aren't being met. So we really need to improve for our BIPOC deaf or hearing communities. We need, for example, when those patients go in to see a provider, they need a BIPOC interpreter. We need systems set up where the curriculums match BIPOC students. We need to develop these things because there are so many different kinds of nuance, and the way that they use language isn't the same across each of these cultures. So a perfect example is my audiologist is a white woman who's hearing, and then I had a hearing interpreter who was white. And I used to working with a hearing aid and cochlear implant, but she kept saying, you have to get used to it. You have to get used to it. And I was like, I'm already used to that. I know that. Because I had had another audiologist before her who had worked with me for years. Because I transitioned to a new person, I was feeling very oppressed because this person was telling me things that I already knew, and they weren't helping me. Maybe if she was a provider for another white person, she would have been much more helpful. But she didn't know the work that I had put into my hearing already. She had this concept of being a helper, but her concept was out of whack. I mean, that's a huge impact on the deaf BIPOC community. And it's really, really sad.
I agree. It is so unfortunate. I had one person ask about their daughter who has access to American Sign Language, but is really having a hard time. The father has had a hard time with the school because cued speech is really an issue. So basically, the mother is saying she's having to fight the father and the school because they have her in a cued speech program right now. And so my encouragement is to really find a local deaf organization where you live. Deaf organizations have the best resources to give you in your fight for access to visual expressive language for your child. Have a deaf advocate meet with you, come to the school with you at those parent-teacher meetings. Talk to the father, have the deaf advocate speak to the father. Deaf organizations that use sign language are professionals who know how to navigate through these systems. So with your daughter who's got a limit in expressive language, you need to find her resources basically. And basically you have to advocate the needs of how sincerely your daughter needs ASL. So it's interesting. Cued speech, it can help a person understand language, but it can't help them express language. So that's another thing. I think in California, there's a few other states they do have where there are people who, there's a big controversy. Say again? And so we really want the best for your
and there are people who are in oral programs in school, cued speech programs in school, and if they fail those, then they're put into a sign language program, and so they have to work so much harder to get their first language to begin with. They focus so much on their hearing ability, but they need to be in a visual world to be able to excel first, not focus on their hearing skills. they would be able to pick up those other skills much faster otherwise. But instead, they're being delayed with visual skills and their primary language. I mean, like, don't exclude it. I'm just saying, make sure that it's a primary aspect of their education and how the system works. It's very frustrating for teachers of the deaf, when their students get so far behind, but because they keep getting pulled out of class to be put in these other programs.
That is so true. So they've just asked me to repeat the last comment, my response to the last comment. So basically what I was saying was, I want you to reach out to Lead K. It's an organization based in California. Those are folks who can help you, and they can help provide advocacy for you at your daughter's meetings and negotiations with the school district.
It's very important to have a deaf person who knows what to do, who will best have resources to help your child. And then that's also a role model. Without that person, the other hearing people in the environment won't have an understanding of what kind of a person that your child could become or who they've been taught by before. It's not just look at the people who can hear well or have been able to succeed in life. That's not the point. The point is they have language needs. They deserve access to all of that. So you need another person who's involved in this process to be able to help navigate that with you, but then also a role model for your child.
That is so true. That's where Audism comes in. That just lack of understanding. People don't see their blind spots. People are who are very heavily into oralism. That's what we call autism. They're more focused on the audiological functioning of your hearing, but they're forgetting that the best way for a child who cannot hear in their future is a visual language, and they're often deprived. They're language deprived because they can't hear and they're not exposed to visual language. And so this belief in autism that deaf children are deprived because they can't hear is not true. We can provide them with different ability to communicate. Look, I'm loud, I'm deaf, I'm happy to be a deaf person to share that experience and say, hey, to a school. So the school has an opportunity to understand how to interact, to how to challenge the system, really. I mean, at least to try for them to understand the difference between leading with hearing and leading with just language that we have access to.
A few people have asked me, as a deaf person who doesn't speak, I won't be able to be successful because I only use American Sign Language, and I have to encourage them. Of course you can be successful. You just have to learn to adjust they'll have to learn to adjust to you. They can do it. But they have to make an effort as you make an effort. And just not worry, stop focusing on your level of hearing. And we definitely need to support each other.
Yes, I want to respond to Deborah Walter. She asked an interesting question. She's asking why doctors will often, in their diagnosis, write information that doesn't seem quite appropriate or relevant. And really, I mean, every doctor is different. I can't speak for all doctors. Hearing doctors, what we call, non-deaf people, hearing doctors tend to see deaf people as not disease. I don't want to use the word disease, but as something that is a dysfunction. They see something that's not working properly because they know that someone who's deaf, and they believe it in the medical views, that something's wrong with their child. And so, it sounds like this one doctor was saying, oh, this child has good manners. It's almost like a pat on the head. But then they're saying that and another doctor would say, about another patient, oh, they have behavior problems. But this doctor doesn't understand deaf culture. They don't understand what's going on at home. They're not thinking about those things. And so without that understanding of the cultural differences, that's why a lot of doctors write really odd comments. You know, when I'm working with my clients, I see strange comments from hearing therapists or hearing doctors because they don't understand deaf culture. And sometimes, honestly, the comments, I just have no choice but to laugh because they're inappropriate. They're clearly from someone who doesn't understand the cultural background of these patients.
A story I know about that, a deaf patient who is Black. And just, I'm a friend. I'm not there as a nurse. I'm just there as a friend. And the nurse gives them an injection to prevent blood clots. And then I said, do you know what she just injected you with? And the patient said, no. And I was like, why don't you just ask what's going on? And she's like, it's fine. I'm sure it's fine. And I said, well, that injection they just gave you was to prevent blood clots. And did you know that? And they said, no. And I said, why don't you ask about that? So when the nurse came back, the patient did say, what is this injection? And the nurse just couldn't articulate with them. And I'm like, that's their responsibility. They have to be able to communicate to a patient what medications are, what they do. Without that clarification, the patient did not understand at all. And I confronted the nurse and I said, did you know that that's your responsibility? And she again had no response to that, you know. And then she asked, do you have any other needs? And no. And it's just so sad that these things happen. Another nurse came in and, hold on, I gotta get my story straight for a moment. I got there and they said, do you need anything? And the deaf patient turned to me and said, I don't know, no one's been telling me anything. And I asked if there was an interpreter, and they hadn't had an interpreter yet. So we called the nurse and I said, what's going on? Why is there an interpreter yet in this situation? And they gave me the runaround. And I said, okay, well, I just became a patient advocate, you know, or said, do we need to get a patient advocate in here, please? So we get the patient advocate in the room, and the patient advocate says, okay, what's going on with her? What's the plan? How long has she been here? Why has she been sitting here for so long for nothing? What's happening? And they, again, had a difficult time. She needs some procedures. She has to take these things. And so the patient advocate says, okay, then why aren't we doing that? And they have this, you know, consternation about schedule. And it's like, no, this patient has things that need to get done. Maybe they have other appointments they have to get to. They can't just be sitting here, you know. And again, they look to me and say, why can't you just do this? And I'm thinking, no, you guys have to be able to have these conversations on your own, but you don't know what's going on. They don't even know what to do with these patients. So we need to work on a workshop teaching these providers how to, nurses, doctors specifically, how to interact with these patients instead of, and then also how deaf patients need to interact with their providers so they don't just sit there and accept whatever is being given to them, that to know that they've got rights and to be able to stand up for themselves.
I am right there with you, 100% behind this idea of educating folks, both providers and patients. It sounds like Kayla's going to turn her screen on and there's a question she wants us to address.
Hello. So one of the questions that we received from Facebook was, it's been reported that in the COVID pandemic, there's a higher proportion of people of color that were impacted. Also, a lot of them were not vaccinated due to lack of access. How can we address this discrepancy and ensure that BIPOC individuals have equal access to healthcare?
That's true. For example, the Pfizer vaccine was given a higher proportion to the white community, whereas Moderna vaccine was given in a higher proportion to the Black community. And I looked into that. And it wasn't about access, it was about a group getting access and resources to the Moderna, because the more people in the area where the Pfizer vaccine was delivered were white. And so I'm thinking, first of all, why is that even going on? But if you dig into it even further, how the vaccine is, how it's viewed in that community is different than how the research looks itself. Was the research done to see the effect of
two different vaccines.
those two different vaccines and the effectiveness of them. So, and then where are you getting those vaccines? Is it CVS? Is it Walgreens? Is it a local pharmacy? Sometimes like a university hospital, like our large hospital will have clinics nearby. And so where are they getting their vaccines from? And if you think to put the vaccines where people are going to go, then they don't have to call around trying to figure out where to get that. But sometimes people didn't have them in their area and they had to call around to see where they could go to get a vaccine. And BIPOC individuals weren't able to get the vaccine where they preferred to.
So many times Black folks feel disempowered. You know, they don't trust the medical profession because they've been lied to. They've been gaslighted. It's very common with people of color. And so people of color often don't want to get the shot, and I don't blame them because many times doctors tell them information that, you know, they don't know. They'll give them a wrong diagnosis, or there's lack of medical advocacy for BIPOC folks. And so they've had these traumatic experiences with the medical field and they don't want to get vaccinated for COVID because they've had these bad experiences where they've experienced oppression. And so it's going to be very hard to re-win that trust of the BIPOC community with the medical field.
Also, research shows a lot of negative effects related to the vaccine, or what kind of research is out there. Like in one famous case in Tuskegee, Alabama, there was a huge outbreak of syphilis. And so research really impacts like the outcome related to research on what's going on in the Black community. We have a long history of distrust, right? In Tuskegee, the syphilis was given to the Black community from an injection.
That's so very true. I'm glad you brought that up.
So another question we got in the chat was, how could I let a deaf person know I welcome feedback on how they're being treated? And maybe to elaborate on that, could you talk a bit about allyship and what is the difference between true allyship, white saviorism, performative allyship?
Well, it's funny because yesterday I was giving a talk about that very thing. And the number one thing that I always really hammered in, and I do every time I give a talk, but in that group specifically, is that cultural understanding is the first place we have to start. If you don't understand the culture, if you don't understand a person's background or their historical context, there's no way you can be an ally. You're always going to be an outsider. You're always going to be perceived as a white savior if you don't understand where this person is coming from. But if you understand their cultural background, the hardships, the things they've really gone through, if you ask those hard questions and learn along the way, that's when you form that bond of trust. That's when you're empowering those marginalized communities. That's when you create comfort in those marginalized people. It's not about you. It's not about you knowing more. It's about them first. And if you can communicate that, then you can develop allyship with your curiosity.
That's right. And I have a former roommate who's white. She's a woman, older. And in her time, you know, there was racism and there's segregation, you know, so here we are as roommates, and it's difficult because we have that cultural aspect, which the two of us were so different. The way that we thought was different. Our behaviors were different. The way that I spoke, the way that she spoke. So we really had to work together, you know, and to understand that when I was saying something, it wasn't meaning that, but for her to really get at what I was trying to say, you know, and not to be offended by something, but to really realize no. And she would again eventually become an ally and say, when other people misunderstand me, she would say, no, you misunderstood her. That's not what she meant. That's not how her culture was talking about. And so, and she would see the way that Black people would express themselves and think they were angry, you know. Or so my roommate came with me once, you know, and I said, well, what exactly do I need to do? And they were demanding that I paid this specific amount. And I was saying, okay. So I pulled out a checkbook and I was saying, what else do you need? And they say, I don't need it right now. I need it later. I said, are you okay? My roommate pulled out her checkbook to pay for me. And they were like, oh, we don't need it now. We need it later. So then she kind of pushed back at them and saying, I'm sorry. So you were trying to force her to do something? And they were just aghast. Another time there was a office at school and she overheard what was going on. She said, do you know that they're saying this? And I didn't realize that. And the president was having these financial meetings. And she caught them. She's like, you're doing something with her finances. You're doing something with the way that she's paying for school. And they were totally caught off guard, but she was supporting me in that. She was able to hear what was going on and put me in the situation. So sometimes she would step in to a situation, but it wasn't to oppress me as a Black person. And she would step in to say, you actually cannot oppress my roommate because she's Black. She was trying to say, right? So she was trying to say that you need to provide funding, but that was oppressive because it was a negative view of the Black community that they couldn't afford it.
So we have another question in the chat, and I'm going to summarize it a little bit. And knowing that racism and autism have been something that has impacted the deaf, Black, the deaf BIPOC community for centuries can be frustrating, especially when it seems that there has been some progress in the deaf white community. How do you not get so frustrated that you aren't still advocating and pushing for policy changes? You know, how do you make sure that you're still being heard by state legislation, by local senates, legislation, having reform? What advice do you have with dealing with these centuries of frustration?
Oh, that is such a loaded question. We still need to stand up for our rights. We must continue to advocate and become loud voices for those folks who cannot. We can use our careers to make changes for all those other people in the community, for the younger folks. We can be leaders, we can be teachers. We have to continue to educate every day. This is a fantastic way to educate others. Things like this. This panel is a wonderful forum to help people make changes and improve situations for folks, but we have such a long way to go. But even having said that, we have to continue the work that we do. We have to continue to fight every day. We have to continue to educate folks, and that will not stop.
We just start small, little steps. During college, I would ask the teacher, you know, please emphasize these topics because these graduates are going to be the leaders in their field. You know, tell them now so that it impacts their work. So during their presentation, they would ask me a lot of these questions and how to change. A girl who just graduated from school became a nurse. And she reached out to me later on and she said, I have a patient who has these characteristics. What do I do? You know, and I was an influence on their career. So I just, one person, I started small, you know, but I'm educating the people around me. I want them to understand the benefits and how they need us in their community.
Another question that we got was, how often do you teach or encourage Black patients to ask for a Black interpreter for best quality services? And can you talk a little bit more about this idea of racial concordance and how patients could best advocate for themselves?
Well, we do that by first contacting hospitals. We're saying, we contact patients. What hospitals are you getting your care from? We ask them, talk to us more about your interpreters. We have to talk to the interpreting agencies and say, do you have any Black interpreters? Why are you not actively pursuing hiring Black interpreters? So we have to really rock the boat of interpreter agencies too. And, we have to say, where are those Black interpreters? Why are you not working to find them? And then in those ways, perhaps they might scramble and turn up one or two Black interpreters, but we have to rock the boat a little bit. And, it's a nice way to at least start things moving slowly but surely.
And you always have the right to ask. I require a Black interpreter for my appointment. They have cultural and linguistic understanding of me. And also reach out to agencies, schools, employers. That's something that they need to work on. For interpreter training programs, they need to do more to recruit students, not deaf. They need to recruit Black students to become interpreters as well. That needs to be on them. And yeah, we definitely need to see improvement in that area.
I agree wholeheartedly.
So we only have about a minute, 2 minutes left. I wanted to see if you wanted to give any closing remarks before we finish.
There's one, I'm so sorry, Leanne. There's one more thing. I just see one post. How can I let a deaf person offer feedback on how I'm doing? And I always just, I don't know, and let them know that they can be honest.
I think one final thought I'd like to leave everyone with is that the goal of a panel like this is to continue the conversation, but not to disempower white people, not to insult anyone in any way, but to help improve the relationships between all these different communities. We've all been fighting for our rights to be respected, to be noted as humans, as equals. And right now, in this moment, we're experiencing a lot of fear, a lot of paranoia, especially, now that we've got the attacks with Russia and Ukraine. And at the same time, we're fighting these, civil racial wars here on the ground in this country. And so we have to work together. We must work together to remember that we can work towards a better future. We have children who are going to look up to us. They do look up to us now, and we need to show them by example and education that we can work for a better world.
And also for those people who are white, not only let the white community have access, but to improve access for BIPOC communities. It's important to show that respect to those communities. So that Black children, this is going to impact their education, not to disenfranchise them, to continue to help them reach their goals and to see that success. I mean, even catching up is an improvement, right? We just need to keep working on being better, and that's it. That's just the way we have to go.
Well, I want to thank you all so much again. Thank you for giving your insights, your experiences, sharing your personal stories. I think it really helped give context for this conversation. And I think it's a start of a very long conversation. It took us centuries to get here. It's going to take more than 1 hour to unpack it all. So I want to make sure to thank again everyone that made this talk possible. The University of Michigan Department of Family Medicine, the interpreting services, Denise and James, who are interpreters today, our two panelists. Also our Deaf Health Talk team volunteers, Pavani and Sanjana, Bettina behind the scenes. There's a lot of people who have helped make these talks possible, including our captionist. So I just want to thank everyone so much. These talks happen monthly, usually either the Tuesday or Thursday, the 4th of the month. So we hope that you continue to join us with these Deaf Health Talks. And thank you again for helping us in this conversation, highlighting these two amazing Black Deaf health professionals. So thank you again, and I hope you enjoy the rest of Black History Month.
Thank you so much.
Thank you so much. Farewell.